Hello everyone, in this video we will talk about anatomy of the nose. So the nose consists of the external nose and the nasal cavity. Both are divided by a septum into right and left halves. External nose consists of the nares and nasal septum, and the lateral margin are called the ala nasi, which is rounded and mobile. External nose has bridge, root, dorsal nasi and a philtrum which is just above the gap, more above the lips. Now see, as you can hear in this image, what I am showing you is the turbinate and the sinuses which is present in the nasal cavity. Discussing little about the nasal cavity, has floor, roof, lateral wall and medial and septal walls. It has three turbinates, superior, medial and the inferior turbinates. Now the floor of the nasal cavity is formed of the palatine process of maxilla. The roof of the nasal cavity is formed by the bridge above, and in the middle it is formed of cribriform plate of ethmoid, and posteriorly it is sloping body of the sphenoid bone. The medial wall of the nasal cavity is the nasal septum, which divides it into the right and the left halves. Now the lateral walls is marked by three projection, which is shown here is the superior, inferior and middle concave, which is also known as the tributary turbinates, and the surface is just below the turbinates is the meatus. So vestibule consists of hair, which is called vibrissae. Atrium, it consists of the middle turbinate. Olfactory region, it consists of the yellow olfactory neuroepithelium, which is having bipolar cells. Respiratory region, now respiratory region is divided into this part: floor, roof, medial wall and lateral wall, as I already discussed. As I told, key floor is made up of palatine process of maxilla. Roof, it is formed of the frontal bone, cribriform plate and the sphenoidal body. Medial wall is the nasal septum. Lateral wall, now the lateral wall is again having some inferior meatus, which is connected with the nasal lacrimal duct, middle meatus having maxillary sinus, frontal sinus, anterior ethmoid sinus, and the superior meatus, which is having the posterior ethmoid sinuses and the sphenoethmoidal recess, which is having sphenoid sinuses. So it is having four meatus consisting of some body. If we take the front transverse sagittal section, then we can see all the sinuses clearly. As you can see here, the maxillary sinus is clearly visible, and these are the frontal sinus, ethmoidal sinus and the sphenoid sinuses in back.